What do I need to know about coronavirus, COVID-19, if I have MND? If you have motor neurone disease, MND, you are at high risk if you catch COVID-19. This is a new strain of coronavirus causing the current pandemic. There is no vaccine for COVID-19 at present. With guidance from clinical experts, we have produced this animation to help you during the outbreak. COVID-19 can cause a fever, a dry cough, and shortness of breath. Some people may also have a stomach upset or lose their sense of smell or taste. With COVID-19, some people develop pneumonia, which is particularly risky if you already have breathing problems with MND. It is very important that you try to avoid the infection. If you have an urgent query, most hospitals, care teams and GPs can offer remote consultations by telephone or video contact. Download applications that enable video messaging on your mobile phone or tablet. If you have speech and communication difficulties, there may be other ways to contact your doctor and care team. For example, by email or text message. Ask your carer to support these communications if needed. Carers and care workers must take extra care with hygiene and hand washing, especially when entering your home, helping you to move, preparing your food, or supporting you to eat or drink. Immediate family, carers and care workers should isolate themselves for 14 days away from you if they have any COVID-19 symptoms such as a new persistent cough or fever, or have been in close contact with someone else who has these symptoms. This means not entering your home during that time. If they live there and cannot stay elsewhere, they should stay in a separate room. You may need to plan for alternative care support in case this happens. If you have a professional care worker who becomes unable to support you, contact the care agency first for guidance. If the care agency cannot help, and if family or unpaid carers are unable to support you, contact your local authority for help in England and Wales. Search for Find Local Council at www.gov.uk. In Northern Ireland, contact your local health and social care trust. Search for Health and Social Care Trusts at www.nidirect.gov.uk. If you develop symptoms of COVID-19, you must self-isolate for 10 days. Anyone who lives with you and remains well should self-isolate for 14 days from the start of your symptoms. When in self-isolation, think about the following. If needed, ask your carers for help. Maintain hygiene according to NHS guidelines, as shown in the link at the end of this animation. For example, don't touch your eyes, nose or mouth if your hands aren't clean. If needed, ask a carer for help with hand washing and NHS hygiene guidelines. Paracetamol is recommended to help reduce fever, so keep some at home. You should take a maximum of 1 dose every 4 hours. If your doctor or local pharmacy is unable to supply any medications that you need, ask them how to order these from a reputable provider. Have enough household supplies and groceries at home to enable you to self-isolate for a period of time. You may also need help with food shopping and picking up medical supplies. If you do develop a fever or a new persistent cough, do not visit a surgery or clinic. This could spread the virus and may mean they have to close. Instead, stay at home and contact a member of your care team by phone, text or email. This could be your GP, the team at your MND care centre or network, or your local neurological service. If your symptoms worsen, contact the NHS by telephone as follows, or ask a carer to help. Tell them you have a condition that places you at risk. Dial 111 for the NHS 111 service, which provides guidance across England, Wales and Northern Ireland, should coronavirus symptoms get worse. For more about coronavirus and MND, including the use of assisted ventilation equipment, recommendations about the use of oxygen, MND alert resources, and wider information, see our website at www.mndassociation.org/MND-and-coronavirus. COVID-19 is a new virus. This means facts are still emerging and national guidance is changing. For the latest government advice, search for coronavirus at www.gov.uk or in Northern Ireland at www.nidirect.gov.uk or in Wales at www.gov.wales. Find NHS advice on coronavirus at www.nhs.uk/conditions/coronavirus-COVID-19. For further support, contact MND Connect on 0808 802 6262 or email mndconnect@mndassociation.org.